The COVID-19 pandemic has hit the entire world hard, but it has especially impacted the mental and physical well-being of many individuals.
Again, let's start by looking at what is COVID-19. COVID-19 is a disease caused by the novel coronavirus known as severe acute respiratory syndrome coronavirus.
The physical symptoms of COVID-19 are known to include dry cough, fever, and runny nose. In extreme cases, it can even lead to the destruction of the lung's protective lining, resulting in respiratory failure.
I am sure that many of us are already aware of the physical symptoms of COVID-19, but it is equally important to discuss its less known effects, which are its adverse mental health consequences. In order to protect the population from being exposed to this disease and to slow its spread, the Canadian government implemented quarantine restrictions in 2020. According to a study done by Law and Chan in 2020, it is evident that these quarantine restrictions could detrimentally impact the physical and mental health of the population, as decreased perceived physical activity due to the COVID-19 pandemic was linked to a higher stress and anxiety response in individuals. When pandemics arise, people with mental health disorders are generally more vulnerable to infections for several reasons. A report released on February 9, 2020 by Yao et al. Looked at inpatients in a psychiatric hospital in Wuhan, China. This revealed that mental health disorders can cause an increase in the risk of infections for diseases such as pneumonia and COVID-19. These individuals who are already suffering from mental illness could face distinct challenges during a pandemic, such as cognitive impairment, little awareness of disease risk, and diminished efforts regarding personal protection in patients. Moreover, once this vulnerable population is infected with COVID-19, they will face more barriers in accessing healthcare services because of discrimination associated with mental health in healthcare settings. These effects can be worsened by the lack of treatment for COVID-19, leading to increased biological problems among inpatients. Now let's discuss treatment. A study from Contang Angelos et al. In 2020 showed that if patients with a psychiatric disorder are infected with COVID-19, antiviral drugs must be used in combination with antipsychotic, antidepressant, and anti-anxiety drugs. If antiviral drugs are used without supplemental medication, patients with psychiatric conditions can relapse back into their mental illness. One medication which can worsen the effects of COVID-19 is the prescription of clozapine. This is used to treat certain mood disorders, such as schizophrenia and schizoaffective disorders. However, researchers have discovered that clozapine may be associated with a higher risk of pneumonia. Clozapine levels can increase with acute systemic infection, leading to symptoms of clozapine toxicity and seizures. Considering the current pandemic situation, the use of clozapine can actually worsen COVID-19 effects on physical health.
Now, let's take a look at how quarantine restrictions have affected the mental well-being of the general population. A study from Contang Angelos et al. Showed the impacts of quarantine and its effects on increasing rates of psychiatric symptoms, among many others such as stress and depression, some of which persisted even after quarantine was lifted. A study conducted by Torrells et al. Shows the increasing prevalence of PTSD in the general population, ranging from 4% to 41%, as well as the prevalence of major depression increasing by 7% after the outbreak. Many of these mental health problems could worsen one's fight against COVID-19 and have a long-lasting effect on their overall well-being. In addition to mental health impacts, quarantine restrictions have also caused many physical health changes. A study done by Maitoli et al. Looked at the effects of the COVID-19 pandemic on cardiovascular risk. The study revealed that this shift in lifestyle can cause long-term effects on cardiovascular disease, mainly related to an unhealthy, sedentary lifestyle and anxiety. Due to the anxiety of food shortages, it is possible that many people will purchase packaged food rather than fresh food. This may lead to an unhealthy diet, as well as a reduced intake of antioxidants, which are essential in protecting the blood vessels in our body and help offer protective effects against cardiovascular disease. The reduction of physical activity will increase oxidative stress in cells, which can lead to vascular inflammation, vasoconstriction, and LDL oxidation, which can further lead to cardiovascular disease. It is also important to mention the role of negative psychological factors, such as depression and anxiety, in the development and progression of cardiovascular disease. The 2019 American College of Cardiology guidelines recommend that adults should engage in at least 75 minutes per week of vigorous intensity aerobic physical activity to reduce the risk of cardiovascular disease. Therefore, it is necessary to promote physical activity at home during quarantine.
Here is a list of strategies for the general public to minimize outbreak-related stress and mental health impacts. The assessment of the accuracy of information provided on the pandemic, enhancing social support, reducing the stigma associated with the disease, maintaining as a normal life while adhering to safety measures, and the use of available psychosocial services, particularly online services when needed.
Here are some resources available for people in Hamilton experiencing mental health impacts, which include the Canadian Mental Health Association Hamilton, the Hamilton Mental Health Outreach, and the City of Hamilton Mental Health Services Program. If you or anyone that you know are facing these issues, then please contact these sources to get support.
Now, let's recap what we learned today. First, we learned that individuals with mental health disorders are generally more vulnerable to infections for various reasons, and they will face more barriers in accessing healthcare services amidst the pandemic. We learned about how treatments such as clozapine for treating schizophrenia may worsen the effects of COVID-19 on physical health, posing even more barriers for individuals suffering from mental health issues in receiving the treatment they need. Finally, we learned about how the implementation of quarantine restrictions has detrimentally impacted both the mental and physical health of the general population. In particular, we spoke about the increased prevalence of mental health symptoms and disorders, cardiovascular disease, and the importance to promote physical activity while at home during quarantine.